Hi everyone, let's talk knees today. Why knees? And what do they have to do with the nervous system? Technically nothing. Technically everything. It's been a hot topic as of lately, people bringing up tight knee, uncomfortable knee. People come in with an issue in their knees and we tie it into the spine and nervous system. And I'm going to share with you why they're so interconnected and why a chiropractor who is actually adjusting the nervous system in the spine can have huge impact on the knees without even touching them. I just examined some this morning, giving me even fresher perspective. Your spine sits inside you and we want it ideally straight. From the side, curvature, curve in the neck, thoracic spine, so we have cervical, thoracic, lumbar. Now, the more important piece relating to the knees typically comes into play with the pelvis. So if these are the two hip bones, tailbone at the back. When people are subluxated, when people have distortions of their pelvis, which will come from birth trauma, it will come from infant and toddler trauma, meaning we all learned to walk, we all fell down multiple times. And a lot of those falls might result in a little force, knocking one side versus a straight down on the bum. Kids will often fall down to the side. So the pelvis has the unfortunate ability to distort, to shift into patterns that get stuck that way, that then affect the lower limbs. Your knee joint is meant to hinge backwards and forwards. That's all it does. One plane of direction. Any rotation happens at the ankle level or at the hip level. Okay, we all know that. What we don't always recognize is that if the pelvis was to distort, and I'm doing a visual exaggeration for you, so the pelvis is distorted and that causes a limb, the upper thigh, to want to turn out, and we don't walk around like a Charlie Chaplin half body. If people remember some of his movies, the lower limb and the foot try to recenter things. Okay? So we have an external outward force and we end up with an internal responsive reconnecting force. What that will do, torsion-wise, twist-wise, is put pressure on the ligaments of the knee, tendons, muscles, and the neurology as well. So while my focus, and as a chiropractor my focus is not to treat the knee, nor is it to treat anything, it's to reduce interference to the nervous system, many times one of the side benefits is knee problems, knee issues get to resolve, get to heal on their own, get to go away, because we've rebalanced and reset the pelvis. Okay? So, if we have a distortion going on, we get to balance that out. The lower limb untwists, the leg below it stops compensating, and it's a huge occurrence for people sitting, people who've done weird things in their life, and others who've done very common things, who just have a torque going on. So, things you may not have known about chiropractic and that connection between knee, pelvis, nervous system, one of the side benefits that occur in helping people regain their health, regaining their optimal function. We see people who say, hey, my knee stops hurting all of a sudden. But just to clarify, if you go out mogul skiing, or like I learned to properly ski just a few months ago, and you have a really nasty torque twisting injury of your knee that I avoided, that is probably something a physiotherapist, massage therapist, active release technique person might address more specifically. But if you have an underlying pelvis issue, it's something to consult a chiropractor about. Hope that's some helpful perspective and leads to more questions and self-discovery.